Hi, my name is Kelly Henry. I'm a registered nurse and a certified diabetes educator, and I work for the Center for Excellence in Diabetes Education here in Northampton, Mass. And today I'm going to be talking about how do we treat hypertension in patients with diabetes. We treat, luckily, the hypertension the same way as we treat diabetes when we're looking at lifestyle. We want a healthy meal plan, we want a healthy amount of activity, and stress reduction. Unfortunately, with hypertension or high blood pressure, a lot of times we really need to treat it with medications. The medications that we use for hypertension and diabetics, one of the most common ones that we use is called an ACE inhibitor, or the name that we use a lot is Lisinopril or Zestril. That's the generic name and the trade name. This drug is actually used widely with patients with diabetes because it does three things. It, one, treats diabetes, treats hypertension and lowers the blood pressure to a healthy range, and it also gives heart protection, so it actually gives people a little protection against heart disease. And then the third thing that it does is it actually prevents protein spilling in the kidneys or into the urine from the kidneys. So some patients are on lisinopril or Zestril long before they even have high blood pressure because they're using it, their physician's using it for prophylaxis with diabetes or heart disease, and they may be using it prophylactically to prevent the spilling of protein in the urine or to treat protein spilling in the urine, and then they may be on it for the hypertension. As far as other meds that we use to treat hypertension and diabetes, there are many different drugs out there. I don't have time to go into all the different drugs, and there are different combinations. This is best treated with your primary care practitioner and all the other things that are going on with your body. There can be different drugs that work in different ways. Some of them work to tighten up potassium control or sodium control, and these are all electrolytes that we have in our body that need to be balanced properly. And some people lose potassium with some drugs or sodium with others, and we have to be careful with that balance. Some of them are what we call diuretics. They help you get rid of the fluid in the body. Some people retain fluid in the body, especially with high blood pressure, and we can get rid of that fluid. We can actually decrease the blood pressure. So there's lots of different meds. They work in lots of different ways, and it's best treated by meeting with your practitioner and seeing what they feel is best for your body and your case and all the different things that may be going on with you. I think that the most important thing you can do, though, is one, see your practitioner on a regular basis, and two, lead that healthy lifestyle, where we look at healthy meal plan. We want to make sure our diets are low in sodium and that we have plenty of fruits and vegetables. And this is part of the DASH diet that some doctors recommend. And then we have plenty of activity, and we have healthy amounts of stress, which is hopefully meaning that we don't have very much stress at all in our lives.